I never had any pain. I went to the doctor because I felt a little bit short of breath. And well, especially living here and going up the mountain, we found out I had lung cancer in 2013. So the doctor came to me and he said, well, I have a very sad message for you. You have lung cancer and it's already in stage 4.
The treatment of non-small cell lung cancer, and in particular advanced disease, metastatic disease, has been changing quite a lot, going into the field of precision medicine, precision oncology.
Nowadays, it is very important when we see a patient with a newly diagnosed metastatic disease that you give hope to the patient. And we really can do that.
I think there were not many alternatives for my treatment. The chemotherapy didn't work anymore. And then they did, I think again, a biopsy here in the hospital of Sion. And there they found out that it was ALK positive. It was a very good thing they found out.
We have to say that it has been a real revolution in the way we do from diagnosis to treatment of patients with non-small cell lung cancer.
Since maybe 20 years, we are starting to identify subgroups of non-small cell lung cancer patients who have very specific characteristics. And most of these characteristics today can be grouped under the name of molecular alterations. It means that the genes, which are usually expressed in a cell, have been modified and result in a phenotype which is the one of being a malignant cell. These alterations therefore need to be diagnosed and if possible, as soon as possible, right at the time you know a cancer, lung cancer is present, you should go into molecular testing and look for these alterations. These alterations are more frequently encountered in patients who have never smoked. And this is easy to understand because what gives rise to the cancer is not the smoking habit, but just the bad luck of the emergence of this mutation. The other thing is these mutations are usually found in adenocarcinoma. So when your pathologists say it's an adenocarcinoma, as opposed by squamous cell carcinoma, then it's adenocarcinoma which really might raise your awareness about the presence of these alterations. So that's how we move now. So good staging workup, molecular alterations evaluation.
And what is currently done is testing for EGFR, for ALK gene rearrangements, for ROS gene rearrangements, and for BRAF mutations. Because for all those 4 situations, there are approved drugs in Europe. The proportion of patients with oncogenic driver mutation varies depending on the continent you work. Here in Europe, we estimate that between 10 and 15% of patients with metastatic adenocarcinoma have an EGFR mutation, between 3 and 5% an ALK gene rearrangement, and in the range of 1% or less ROS1, BRAF mutations.
The most common oncogenic driver changes in adenocarcinoma of the lungs are KRAS, which is occurring in about a third of patients and is related most commonly to smoking habits. And unfortunately, targeted treatments for these mutations are not yet part of our clinical routine.
How you characterize a tumor is not just a lung cancer. It's a lung cancer with a histological subtype. So we have been moving to a more aggressive kind of medicine, but also really in favor and the benefit of patients who sometimes can benefit from very long control of the disease when very specific treatments are I would say, pursued or decided for.
The treatments have multiplied in opportunity, and it's a very different perspective for patients because the median survival is not less than a month, but we're now talking for years.
With this targeted therapy in EGFR and ALK, you can reach 5, 4, 7 years in some series of survival in these patients, with most of the years being characterized by an oral drug being taken orally once or twice per day. So it really completely changes the landscape. So it's very paradigm changing in terms of survival and also in quality of life.
For me, it was the difference between life and death, because I've seen around me a lot of effects of also of lung cancer, people who were dead within 3 months, 3-4 months, when they discovered they had cancer and life was over. And for me, I'm 5 years from the day I found out that I had cancer, and I'm still doing fine. So my life is back again.
Please join us for the next episode, when oncologists discuss the occurrence of targetable mutations and the range of patients who can benefit from novel therapies.